Arrival of the fall season will mean cooler, colder temperatures. It also means you can expect some fall allergies. We're focusing on what causes those allergies and some treatments. Joining us is Dr. Chad Domingue, a local neurologist with the Avila Physician Network. Thank you so much for joining us. Appreciate it.
Good afternoon. This is the season for allergies, unfortunately.
Unfortunately. And what causes allergies for those who don't know?
Yeah, so unfortunately, the long answer is we don't know. I mean, there's a lot of people that get this stuff and we don't know why. There is a genetic predisposition. So if one parent has it, it's about 30–40% chance you will have it. If both parents, it's 60–80%, which is really disturbing, is you can be completely normal your entire life. And then as you get older, you can develop allergies for no reason. Basically, what an allergy is your body is overreacting to a stimuli, an antigen. So it's basically friendly fire. So your immune system, your defense system sees this thing and overreacts to it. So it produces an antibody called IgE. And once that antibody is released, it causes the cells to release histamine. And when histamine is released, it causes our blood vessels to open up. So you get that flush feeling. And it causes the muscles of your respiratory and your digestive tract to crank down. So that's the shortness of breath, the abdominal issues that come with it. But again, unfortunately, we just don't know why some people get it and why some people don't. But it's a very big problem. It's an $18 billion cost to the United States per year.
Yeah, it is huge. It impacts so many people. What are some of the key things daily we do that trigger our allergies?
So when we're talking about the fall season, it is the season of ragweed. There's a couple other ones that can happen this season. Pigweed, sagebrush, tumbleweed, mold spores. I mean, these are all nasty things we don't want to hear. Dust mites is a very common one. And this was interesting as I was doing my research. Dust mites are common in the summertime, but when you first crank that heater on, guess what you're doing? All that stuff that built up over the summer coming straight at your face.
Right.
Pollen, and obviously we live in a very high pollen area, high in the morning, high windy times. But it's just hard to avoid this stuff. I mean, we just live in an area where all these things are right in our face.
And finally, what are some of the treatments you recommend that work?
Yeah, so again, you want to avoid things, which again, good luck, right? You can get these allergy filters for your house, N95 mask, but at the end of the day, you just cannot avoid these things. We're all familiar with the antihistamines. I have several, Zyrtec, Lagra-D, Claritin. These are all daily prescriptions to prevent the allergies. So they dampen the immune system that we talked about being overreactive. But side effects, sleepiness, dizziness, dry mouth. I mean, I've taken antihistamines many times, so these are very common. Flonase is a steroid, a nasal steroid in the nose. What most people don't know about Flonase, it's not an immediate relief. You have to use it all the time. So it takes several weeks before this works. It can cause a bleeding, a thinning of the nasal mucosa, but it is a steroid, so make sure you tell your doctor about it.
Okay.
Navage, this is a new thing that came out. This is like a neti pot, so it basically takes out all the debris and mucus in your nose. There's some evidence that this stuff works, but you got to do it all the time. And lastly, allergy shots, local honey. This kind of works like a vaccine, so you're giving your body the antigen before it happens, so your body's kind of used to it. But again, you got to do it all the time. It's a daily maintenance, and sometimes it works, sometimes it doesn't.
Okay, you gave some really good tips. You went down that list, and there are a lot of options for people to look into. Thank you so much. It's going to be much needed in the coming weeks.
Absolutely. Hope everybody has a safe Halloween out there. Be good and safe.
Yes, and allergy-free.
Oh,
okay. Thank you, Dr. Chad. Have a great day.
All right, Liz. Take care.